last question, we'll finish up our Reddit ones. I seem to have chipped the top of one of my lower incisors about a week ago and wondered if it's something I should worry about. I read somewhere that if you damage the outer layer of your teeth, the enamel, it greatly increases the risk of getting a cavity.
Great question. So if you chip your tooth or if you damage the enamel, should you be worrying about it? Yes, you should really be worrying about it, but depending on how much of a damage that you created. We covered it in one of the questions earlier. If you have a cavity and if your dentist just removed the cavity, can we get away without doing a filling? Again, going back to this one, if you have a small chip, sometimes it may not be even possible to put a filling in there because it's so tiny. Even if you do put a filling in there, the filling is going to immediately come out. So sometimes when the patients come into our office and all we do is like kind of, just kind of file it down. So if it is a small enough chip, then we may just be able to just kind of file it down. You don't need to have any treatment done at all. But if the chip is deep enough, then if it is at the enamel or if it's deep into the enamel or if it's beyond the enamel, then you definitely need to have some kind of a filling done. If you don't, then the tooth is soft enough, now the cavity is going to happen, or once the cavity happens, then the cavity is going to progress and you may end up needing a root canal or you may end up needing to even end up losing the tooth. So my recommendation is if you have a chip in your tooth, immediately go see the dentist, and if it is small enough, and the chances are you may not need any treatment other than having just some filing of the tooth. But if it is deep enough, then your dentist should be able to recommend whether you're going to need a filling. That way you can avoid some extensive and expensive treatment, including having to end up losing the tooth. So go see a dentist if you have a chip on your tooth.